Doctors warn. Skipping. These 7 daily 30-second habits kills seniors silently. Every day, thousands of seniors over 60 are unknowingly skipping simple 30-second actions that doctors say are quietly damaging their hearts, brains, and immune systems. These aren't dramatic lifestyle changes, they're tiny habits most people dismiss as unimportant. Yet medical research proves they're the difference between thriving in your golden years and facing sudden preventable health crises that strike without warning. Today, I'm revealing 7 30-second habits that leading physicians say are non-negotiable after 60. You'll discover the morning routine that reduces stroke risk by 40%, the bathroom habit that prevents deadly falls, the mealtime practice that stops cognitive decline, the bedtime action that protects your heart while you sleep, the hydration technique that saves your kidneys, the simple movement that prevents blood clots, and the overlooked check that catches silent killers early. Each habit takes less time than brewing coffee, yet skipping them creates compounding damage your body can't reverse. Habit 1. The 30-second morning balance. Check. The first habit that could save your life is something most seniors never think about until it's too late. A simple balance check every single morning before you take your first steps. Here's why this matters more than you realize. When you wake up, your body goes through a dramatic physiological shift. Your blood pressure changes, your inner ear fluid adjusts, and your proprioception, your body's sense of where it is in space, needs to recalibrate. For seniors, this transition period is when you're most vulnerable to catastrophic falls. The statistics are sobering. According to the Centers for Disease Control, 1 out of 4 Americans over 65 falls each year, and falls are the leading cause of fatal and non-fatal injuries in this age group. But here's what most people don't know. The majority of these falls happen within the first hour of waking up, and many occur during those very first steps out of bed. Your body loses muscle mass and flexibility as you age, a condition called sarcopenia. Your vestibular system, which controls balance, deteriorates gradually. Your vision changes, affecting depth perception. All of these factors converge in those critical morning moments when you're transitioning from lying down to standing up. The 30-second balance check is devastatingly simple. Before you stand up from bed, sit on the edge for a full 10 seconds. Let your blood pressure stabilize. Then stand up slowly and hold on to something sturdy. Your nightstand, the bed frame, or a chair. Stand there for another 20 seconds and notice how your body feels. Are you dizzy? Is the room spinning? Do your legs feel weak or unsteady? This brief pause does 3 life-saving things. First, it prevents orthostatic hypertension, that sudden drop in blood pressure that causes dizziness and fainting when you stand too quickly. Second, it gives your proprioceptive system time to orient itself. Third, it serves as an early warning system for balance problems that need medical attention. Habit 2. The 30-second medication review. The second life-saving habit is checking your medication labels every single time before you take them. This sounds absurdly simple, but medication errors kill more seniors silently than most people realize, and the danger isn't what you think. Here's the reality that doctors see but rarely discuss publicly. After age 60, your body metabolizes drugs differently. Your liver and kidneys don't process medications as efficiently. Your body composition changes. You have less water and more fat tissue, which affects how drugs are distributed and stored. This means the same medication at the same dose you've taken for years can suddenly become toxic. The Journal of the American Medical Association reports that adverse drug events send over 177,000 seniors to emergency rooms annually, and many of these incidents are completely preventable. But the real killer isn't taking the wrong pill. It's taking medications that have become dangerous due to overlooked interactions or changes in your health status. Most seniors take multiple medications. Perhaps you're on blood pressure medication, a statin for cholesterol, something for diabetes, a blood thinner, and maybe an over-the-counter pain reliever. Each one alone might be safe, but together they can create a toxic combination that your aging body can't handle. Drug interactions intensify with age because your body's ability to compensate diminishes. The 30-second medication review is straightforward but requires discipline. Every single time you reach for a pill bottle, read the label completely. Confirm it's the right medication, the right dose, and the right time of day. Check the expiration date. Expired medications lose potency or develop harmful breakdown products. Look at the pill itself. Does it look the same as yesterday? Pharmacies occasionally make dispensing errors, and catching a wrong pill before swallowing it can prevent a medical emergency. Why do seniors skip this habit? Overconfidence and routine. You've taken the same pills for months or years, the bottles sit in the same spot, and your brain goes on autopilot. You assume you know what you're taking, but assumptions in medicine are dangerous. Consider what happens when you accidentally double dose a blood thinner. You might not feel anything immediately, but internally you're creating a bleeding risk that could manifest as a brain hemorrhage days later. Or imagine taking your morning medication at night instead. Some drugs affect blood pressure or heart rate in ways that become dangerous at the wrong time of day. There's another hidden danger: cognitive decline. Early dementia or mild cognitive impairment often shows up first in medication management. You might forget whether you took your morning dose and take it again. You might confuse one bottle for another. These aren't character flaws. They're medical symptoms that need attention. Habit 3. The 30-second dental rinse. The third critical habit targets something most seniors dramatically underestimate: the connection between your mouth and your heart. Rinsing your mouth with plain water for 30 seconds after every meal isn't about fresh breath or social courtesy. It's about preventing a cascade of inflammatory damage that leads to heart attacks, strokes, and dementia. Your mouth harbors over 700 species of bacteria. Most are harmless, but some are dangerous. And after 60, your body's ability to control these bacterial populations weakens. Saliva production decreases with age and medications. Your immune response in oral tissues becomes sluggish. Gum tissue loses resilience. This creates the perfect environment for pathogenic bacteria to thrive and enter your bloodstream. Research from the American Heart Association has established that periodontal disease, chronic gum infection, is directly linked to cardiovascular disease. But here's what shocks most people. The bacteria from infected gums don't just stay in your mouth. They enter your bloodstream through tiny wounds in your gum tissue, travel to your arteries, and trigger inflammation in blood vessel walls. This inflammation contributes to arterial plaque buildup, increasing your risk of heart attack and stroke by up to 50%. The connection gets worse. These same oral bacteria have been found in the brains of Alzheimer's patients. Scientists now believe that chronic oral infections may be a contributing factor to cognitive decline, as bacteria and inflammatory compounds cross the blood-brain barrier and damage neural tissue over time. Most seniors brush twice daily and think that's sufficient. But food particles and sugars remaining on your teeth and gums between brushing sessions feed bacterial growth throughout the day. Every meal creates an acidic environment that weakens enamel and inflames gum tissue. Waiting 12 hours between brushings gives bacteria ample time to multiply and cause damage. The 30-second water rinse after every meal disrupts this cycle. Swish vigorously. Don't just sip and swallow. Force the water between your teeth, around your gums, across your tongue. This mechanical action dislodges food particles, dilutes acids, and reduces bacterial load before they can establish a foothold. Why do seniors skip this? It seems unnecessary, especially if you're not eating anything sticky or sweet. Many grew up in an era when dental health meant avoiding cavities, not preventing systemic disease. The connection between oral health and heart disease wasn't established until recently, so it's not part of older generations' health consciousness. There's also the misconception that mouthwash is a substitute. Commercial mouthwashes often contain alcohol that dries oral tissues, actually worsening the problem for seniors who already produce less saliva. Some antibacterial rinses kill beneficial bacteria along with harmful ones, disrupting your oral microbiome. Plain water is gentler, safer, and just as effective for the immediate goal of removing debris. Habit 4. The 30-second deep breathing exercise. The fourth habit that doctors wish every senior would adopt is a controlled deep breathing exercise done 3 times daily. This isn't about relaxation or meditation, though those are benefits. This is about maintaining lung capacity and oxygenation levels that quietly decline with age, starving your organs of the oxygen they need to function properly. After 60, your lungs undergo structural changes that most people never notice until they're severe. The air sacs, called alveoli, lose elasticity. Your rib cage becomes stiffer. The muscles that control breathing, particularly your diaphragm, weaken. Your lung tissue itself becomes less efficient at transferring oxygen into your bloodstream. The result is a gradual decline in oxygen delivery to every cell in your body, and the consequences are far more serious than feeling winded climbing stairs. Chronic low-grade hypoxia, insufficient oxygen in your tissues, accelerates cognitive decline. Your brain consumes 20% of your body's oxygen, despite being only 2% of your body weight. When oxygen levels drop even slightly, brain cells begin to malfunction. Memory formation suffers. Processing speed slows. Decision-making becomes impaired. Many symptoms attributed to just getting older are actually preventable consequences of poor oxygenation. Your heart suffers too. When tissues don't get enough oxygen, your heart compensates by working harder, pumping more blood to deliver the same amount of oxygen. This increased workload strains cardiac muscle, elevates blood pressure, and can trigger dangerous arrhythmias. Over months and years, this chronic stress contributes to heart failure, a condition where your heart simply can't keep up with your body's demands. The immune system is another hidden victim. White blood cells need oxygen to function effectively. Reduced oxygen levels impair your body's ability to fight infections, heal wounds, and detect cancerous cells. This is why seniors with poor lung function have higher rates of pneumonia, slower recovery from illnesses, and increased cancer risk. Most seniors breathe shallowly without realizing it. Shallow breathing uses only the upper portion of your lungs, leaving the lower lobes underutilized. This creates areas of poor ventilation where mucus accumulates and infections can take hold. It also means you're using only a fraction of your lung capacity, accelerating the decline in respiratory function. The 30-second deep breathing exercise reverses this pattern. Here's the technique. Sit or stand with good posture. Place one hand on your chest and one on your abdomen. Inhale slowly through your nose for a count of 4, focusing on expanding your belly, not your chest. This engages your diaphragm and fills the lower portions of your lungs. Hold for a count of 4. Then exhale slowly through pursed lips for a count of 6, completely emptying your lungs. Repeat this cycle 3 times. The entire process takes 30 seconds. Habit 5. The 30-second foot inspection. The 5th habit that saves lives is examining your feet every single evening before bed. This seems trivial until you understand that your feet are early warning systems for circulatory problems, nerve damage, and infections that can progress to life-threatening complications within days. After 60, peripheral circulation naturally decreases. Blood vessels narrow. The heart's pumping efficiency declines. This means your feet, the furthest points from your heart, receive less blood flow. Reduced circulation brings less oxygen, fewer immune cells, and diminished healing capacity to your lower extremities. For diabetics, this problem intensifies dramatically, but even non-diabetics face significant risks. Peripheral neuropathy affects nearly half of seniors over 65 to some degree. This nerve damage reduces sensation in your feet, meaning you can develop serious injuries without feeling pain. A small blister from new shoes, a minor cut from walking barefoot, or an ingrown toenail can become infected without you noticing. By the time symptoms appear elsewhere in your body, fever, red streaks traveling up your leg, swelling, the infection may have spread to your bloodstream, causing sepsis. The progression from minor foot wound to life-threatening emergency can happen in 48 to 72 hours for seniors with compromised immune systems or circulation issues. Sepsis kills over 270,000 Americans annually, and foot infections are a common entry point, especially in older adults. There's another serious risk: undetected ulcers. Poor circulation, combined with pressure points from walking or ill-fitting shoes, can create skin breakdown that develops into open sores. These ulcers are notoriously difficult to heal in seniors and can become chronic wounds that penetrate deep into tissue, reaching bone and causing osteomyelitis, bone infection. This condition often requires aggressive antibiotic therapy or even amputation. Vascular disease also announces itself through foot symptoms. Peripheral arterial disease causes reduced blood flow that manifests as color changes in your feet. They may appear pale, bluish, or reddish. The skin may feel cooler than normal. Hair growth on your lower legs and feet may thin or stop. Toenails may thicken or grow abnormally. These are warning signs that arterial blockages are reducing circulation, and those same blockages exist throughout your body, including arteries feeding your heart and brain. The 30-second foot inspection is systematic and thorough. Sit in good lighting where you can see your feet clearly. Use a mirror if needed for the soles and between toes. Check between each toe for cracks, peeling skin, or fungal growth. Examine your soles for any discoloration, calluses that might be hiding ulcers underneath, or areas of unusual warmth that signal infection. Look at your toenails for signs of fungal infection, ingrown edges, or trauma. Check the tops and sides of your feet for cuts, bruises, swelling, or changes in color. Feel the temperature. Both feet should feel similar. Note any new pain or numbness. Habit 6. The 30-second hydration check. The sixth habit that medical professionals desperately want seniors to adopt is checking your hydration status before drinking your first beverage each morning. This isn't about drinking 8 glasses of water daily. That's oversimplified advice. This is about recognizing that chronic dehydration is silently damaging your kidneys, heart, and brain in ways that become irreversible. Aging fundamentally changes your relationship with water. Your thirst mechanism deteriorates. The hypothalamus becomes less sensitive to dehydration signals, so you simply don't feel thirsty even when your body desperately needs fluid. Your kidneys lose their ability to concentrate urine efficiently, meaning you lose more water throughout the day. Your body's total water content decreases as muscle mass declines and fat tissue increases. Many medications prescribed to seniors, diuretics for blood pressure, antihistamines, laxatives, further deplete fluid levels. The consequences of chronic mild dehydration are devastating but gradual, which is why they go unrecognized. Your blood becomes thicker and more viscous, forcing your heart to work harder with every beat. This increased cardiac workload over months and years contributes to heart disease and increases stroke risk. Thicker blood flows more slowly through small vessels, reducing oxygen delivery to tissues. Your kidneys are particularly vulnerable. They need adequate fluid volume to filter waste products from your blood. Chronic dehydration forces kidneys to work in a concentrated, high-stress state that damages the delicate filtering structures called nephrons. Once nephrons die, they don't regenerate. Progressive kidney damage is often silent until you've lost 75% of kidney function, at which point you're facing dialysis or transplant. Cognitive function suffers immediately from dehydration. Research shows that even 2% fluid loss impairs memory, attention, and psychomotor skills. For seniors already experiencing age-related cognitive changes, dehydration compounds the problem. What looks like dementia or confusion might actually be chronic dehydration, a completely reversible condition if caught early. Constipation, another common senior complaint, is often rooted in insufficient fluid intake. Your colon absorbs water from waste material, and when you're dehydrated, it absorbs too much, creating hard, difficult-to-pass stools. Chronic constipation leads to hemorrhoids, bowel obstruction, and decreased quality of life. The 30-second hydration check uses simple observable signs. First thing in the morning, before drinking anything, check your urine color. It should be pale yellow, like lemonade. Dark yellow or amber indicates dehydration. Next, pinch the skin on the back of your hand and release. In well-hydrated people, skin snaps back immediately. If it tenses up and slowly returns to normal, you're dehydrated. Check your mouth. Your tongue should be moist, not dry or sticky. Look at your lips. They shouldn't be cracked or overly dry. Habit 7. The 30-second vision. Self-test. The seventh and most surprising habit is performing a quick vision assessment each morning using both eyes separately. This isn't about whether you need reading glasses or a new prescription. This is about detecting vision changes that signal medical emergencies, strokes, retinal detachments, and brain tumors that require immediate intervention to prevent permanent damage or death. Your eyes are direct extensions of your brain, and changes in vision often reflect what's happening in your cerebrovascular system before any other symptoms appear. For seniors, sudden or gradual vision changes are frequently dismissed as normal aging, when they're actually urgent warning signs that a medical crisis is unfolding. Stroke is the most time-sensitive emergency that vision changes can reveal. When blood flow to your brain is interrupted, vision symptoms often appear first. Blurred vision in one eye, sudden loss of peripheral vision, or double vision. Most people wait to see if it resolves, not realizing that every minute of delayed treatment means more brain tissue dies. The window for effective stroke treatment is typically 3 to 4.5 hours. Recognizing vision changes immediately can mean the difference between full recovery and permanent disability. Retinal detachment is another silent threat that progresses rapidly in seniors. The retina is the light-sensitive tissue at the back of your eye, and as you age, the vitreous gel inside your eye shrinks and can pull away, tearing the retina. Once detached, the retina loses its blood supply and begins to die. Early symptoms include sudden floaters, flashes of light, or a shadow or curtain moving across your field of vision. Without surgery, within 24 to 48 hours, permanent vision loss occurs in that eye. Giant cell arteritis is a condition that predominantly affects people over 60 and causes inflammation of blood vessels, particularly those supplying the head and eyes. It can cause sudden, painless vision loss in one eye. Without immediate high-dose steroid treatment, the other eye typically loses vision within days. This condition is often missed because patients assume their vision problem is cataracts or simply age-related decline. Glaucoma, the silent thief of sight, damages your optic nerve gradually through elevated eye pressure. Most people have no symptoms until significant peripheral vision is lost, and that damage is permanent. Daily monitoring helps you notice subtle changes like difficulty seeing objects to your side or bumping into things more frequently. Macular degeneration affects central vision and is the leading cause of blindness in seniors. Early detection through self-monitoring can lead to treatments that slow progression significantly. Warning signs include straight lines appearing wavy, dark spots in your central vision, or colours appearing less vibrant. The 30-second vision test is remarkably simple, but requires consistency. Each morning, cover your left eye completely with your palm. Using your right eye only, look at something with straight lines, a door frame, window blinds, or tile edges. Check if lines appear straight or wavy. Look at text on a bottle or book. Can you read it clearly at normal distance? Check your peripheral vision by extending your arms out to the sides and wiggling your fingers while looking straight ahead. Can you see the movement? Now repeat the entire process with your left eye while covering your right. These 7 30-second habits aren't demanding. They're protective shields against the silent threats that steal independence, health and life from seniors. Balance checks prevent devastating falls. Medication reviews stop toxic errors. Dental rinses protect your heart. Deep breathing preserves your brain. Foot inspections catch infections early. Hydration monitoring saves your kidneys. Vision tests detect emergencies. Together, they require less than 4 minutes daily, but add years to your life and life to your years. Start tomorrow morning. Your future self will thank you.